And joining me now is Dr. Amesh Adalja. He is an infectious disease doctor. Thanks for joining us. This warning that we're now hearing, one that is very rarely used, the public health emergency of international concern, it's actually only been used 4 times before. So how dire is this emergency? How bad is the situation?
Well, right now we have a regional emergency with Ebola, with some spread from the DRC into Uganda. But what this declaration recognizes is that if the world's resources aren't brought to bear on this outbreak, if people don't start controlling this number of cases, it could spiral rapidly out of control, because this has been arguably the most challenging Ebola outbreak because of the conditions in that war zone that have made it really impossible to stop.
So you mentioned the war zone. The Ebola is treatable, if I understand correctly. And right now, the fact that the outbreak is in an active war zone is affecting the meds from reaching the people. Am I correct?
Well, there is no official cure for Ebola, but we do have a highly effective experimental vaccine that's being used in this outbreak, something we didn't have in the 2014 outbreak, as well as experimental antiviral therapies, a lot of knowledge about what supportive therapies work. But you actually have to find the cases, you have to isolate them, you've got to get them into places where they can actually be treated, but they haven't been able to do that. Many of these cases go without being noticed, and it becomes a catch-up game that they've been playing for over a year now, with over 1,700 deaths. So we really need to get the resources in place, and people need to really recognize this for the dangerous outbreak that it is before it spreads to neighboring countries.
Now, apparently the reason the alarm was finally rung so loudly is because the virus made it to a city, to Goma. And why is that so alarming? And why would you say this was the moment where those alarms started to be sound?
Well, the emergency committee for the WHO had been convened several times and declared this not to be an emergency. And they took a lot of criticism from public health authorities. This was kind of puzzling that it took so long for them to declare this public health emergency. But when you have a disease in a city, in an urban environment, it becomes much easier to spread and much harder to track contact. So that was a danger. And Goma is a place where there are international flights to places like Ethiopia, for example. So there is a concern it could spread out of Goma. But this is the straw that kind of broke the camel's back here, because this was something that was long overdue. Even after cases were in Uganda, they did not declare an international concern emergency.
So what precautions are being taken, and why is Ebola so difficult to contain?
Well, in the past, before 2014, Ebola outbreaks have been very easy to contain because they were happening in rural areas where you had a high compliance rate among the population, that you could go into the community, teach people how to take care of the patients there in a safe manner, how to bury bodies, and you could actually extinguish these outbreaks very, very quickly. But what we learned in 2014 is that if the population isn't receptive to those public health messages, outbreaks can spiral rapidly out of control. So what you'll see now is, for example, more epidemiologists on the ground. We know that the CDC in the United States is working to bring epidemiologists to the DRC to try and stop this outbreak. We're going to see renewed interest in increasing vaccination rates, more surveillance of people that are moving in and out of cities, across borders, for example, into Uganda. And you're going to have much more public health messaging telling people what Ebola is and how to stop it. So hopefully this will all slowly begin to turn the tide against this outbreak that's gone on for far too long.
Indeed. Dr. Amesh Adalja, thank you so much.